Welcome to this video about working effectively with assessing professionals. Types of assessing professionals. SENCOs and SEND teams regularly work with professionals to identify and/or assess a pupil's special educational needs and disabilities, and provide and/or advise on appropriate support and/or treatment. Usually these professionals work within the National Health Service, are part of the local authority, or are commissioned independently by the school. Sometimes parents and carers also arrange or commission assessments and treatment for their child. The most common SEND professionals for this work include speech and language therapists, occupational therapists, community paediatricians, mental health specialists, and educational psychologists. Speech and language therapists. Speech and language therapists assess and organise intervention programs to treat speech, communication, and language difficulties. This includes, for example, developmental language disorder, expressive and receptive language delays, stammering, and pragmatic language difficulties. Occupational therapists. Occupational therapists assess and organise intervention programs focused on carrying out everyday tasks. With children and young people, this is most often relating to motor skill difficulties, including possible developmental coordination disorder, known commonly as dyspraxia. Advice may also be given about sensory integration and processing needs. Community paediatricians. Community paediatricians are specialist medical doctors who focus on the health and development of children and young people, working in community settings rather than hospitals. They assess, diagnose, and manage a wide range of developmental and physical issues, working as part of a wider child development team. Schools will usually seek assessment from community paediatricians for autism, known medically as autism spectrum disorder, and for ADHD. Mental health specialists. Mental health specialists, including psychiatrists, psychologists, psychotherapists, and other registered therapists, assess and/or treat a range of mental health difficulties, including, for example, anxiety, depression, attachment difficulties, self-harm, and suicidal ideation, as well as less common disorders such as eating disorders, obsessive-compulsive disorder, post-traumatic stress disorder, and psychosis. Educational psychologists. Educational psychologists can provide a wide range of specialist assessment, consultancy, and training services to identify and address pupils' barriers to learning. For work with individual pupils, schools will often seek support with assessing cognition and learning needs, including, for example, specific learning difficulties such as working memory, processing, and literacy difficulties. It is important to note that qualified assessors of specific learning difficulties can also carry out some assessments to identify needs such as dyslexia. Educational psychologists also often undertake comprehensive and holistic pieces of work to identify a pupil's needs across each category of SEND, which can inform medium and long-term planning of SEND provision. This work is sometimes undertaken following the work of other assessing professionals. Before working with assessing professionals. As part of the graduated approach to identifying SEND, it is vital for schools to apply the Assess, Plan, Do review cycles. If there are concerns about a pupil, the initial evidence base might include collated and organised information from sources that are routinely available in the school. For example, the views of the pupil, parents and carers, and staff, lesson observations, progress and attainment records, baseline assessments, outcomes from interventions, class work samples, and behaviour and pastoral support records. The next step is to use checklists and then any available screeners to identify signs of specific types of SEND. Once this work has been undertaken, a referral can be made to an appropriate assessing professional, supported by this evidence. After working with assessing professionals. Following a professional's assessment, it's important for the school to ensure that the information acquired from the assessment and the recommendations are followed through in school. This includes, for example, clear and up-to-date information for teachers and support staff about the pupil's needs, for example in the form of a pupil profile, and/or other types of support plans, which should also list key adaptive high-quality teaching strategies and any necessary reasonable adjustments. Any necessary access arrangements for controlled assessments and exams, and listing of planned and monitored targeted interventions, usually in the form of a provision map. It is often helpful to annotate the links between provision and professionals' recommendations. This is the end of this video. You can view more videos on this channel in the Bite Size series, including other Bite Size Senko's videos.